even celebrities like Whoopi Goldberg suffered from oral health problems. Jennifer Lawrence was even confronted for her quote-unquote bad breath. Welcome to Ask Dr. Ting, and in this video, we'll highlight the oral health problems patients would usually complain about and some old and new routines that are worth trying. Here are the 10 oral health routines and problems in 2021. Sometimes after a long, exhausting day, we might be too tired to stick to our routine. After sitting down with personalities like celebrity fitness coach Julian Michaels and Trump advisor George Ross, we realized that even these public personalities know how important preventive care is to ensure that they won't have any oral health problems. If you're nowhere near thinking of sticking to an oral health routine, let us remind you of the 5 worst things that could happen. Number 1. Gum disease. Did you know that actress Whoopi Goldberg revealed that she suffered from gum disease? In 2016, she shared this experience with the viewers of the popular talk show, The View. Gum disease all starts when you neglect to brush. It lets plaque accumulate underneath the gum line and causes bacteria to propagate. This progresses into a gum disease that might be irreversible and could lead to teeth and gum problems. Goldberg now uses her voice to remind people on how to prevent this from even starting. Number 2. Bad breath. Halitosis, or more commonly known as bad breath, is a strong smell that lingers inside your mouth caused by an underlying tooth or gum problem. For instance, while filming a kissing scene for the movie The Hunger Games, actor Liam Hemsworth hilariously remarked to his co-star Jennifer Lawrence how her mouth stinks with garlic. Strong-tasting foods as such cannot be easily washed away with just breath sprays. Imagine eating similar foods during the day and not brushing your teeth before bed. Add the fact that these foods will produce acids and create that unlikely smell, which can eventually lead to developing bad breath. At some point, bad breath or body odor in general has been a cause of trouble in human relationships. As cited from various open forums where people share their dilemmas and seek help on how to deal with their partners suffering from bad breath or body odor, oftentimes people don't even know that they already have bad breath. And when they realize that they do have it, most of them feel embarrassed, which often leads to them being defensive about their condition and sometimes even refusing help or dental reconstructive care. This causes a rift in relationships, which usually leads to indifference or sometimes even separation. Number 3. Tooth decay. People who have been neglecting oral hygiene for quite some time will now start developing cavities or tooth decay. These are tiny holes in your tooth enamel where all the bacteria can easily get into at any time. If you're lucky, you might also experience terrible toothaches. Tooth decay, when ignored, could lead to permanent damage to certain areas of your tooth and eventually lead to tooth loss. Number 4. Tooth loss. Tooth loss is cute when you're a kid, but when you're an adult, it can make you lose your confidence, especially when you have to interact with people. Tooth loss happens when tooth decay aggravates the nerve within the tooth. Toothache occurs and can heighten to an unbearable level. Inflammation and infection will begin to develop, and when the tooth becomes unrestorable, extraction becomes inevitable. This will unfortunately introduce you to dental implants and the like. Tooth loss can be easily prevented. Visit your dentist to seek help on preventive care. Number 5. Heart disease. In 2018, a study showed that in 65,000 cardiovascular events such as heart attack or stroke, poor oral health and/or tooth loss have been observed. You may think, how can it be a contributing factor to stroke or heart attack? Bacteria from gum disease can travel from your bloodstream, reaching certain organs like the heart and even the nervous system. This goes undetected because there isn't any pain until it's too late. Allowing these bacteria to build up underneath your gums increases the possibility of these cardiovascular events. Did that motivate you a little? I hope it did. To help you build and/or improve your oral health routine this 2021, here are the 5 of the old and new routines that actually work. Number 1. Download an app that reminds you of your oral routine. If you've been struggling to establish a routine and always have your phone with you, why not try getting help from a mobile app? Brush DJ is an app designed to help remind you of the steps in your routine. You can set reminders for daily brushing, dental appointments, when to change your toothbrush, and a lot more. Brush DJ is available for free in Google Play Store and App Store. Number 2. Make your toothbrush overtly visible. You must brush your teeth at least 2 times a day. Getting yourself reminded to do this is already hard. Putting away your oral health equipment will just make it even harder. People tend to forget to use what they don't see. Place it around your sink where it's easy to see and reach. As simple as seeing things makes up for a good reminder. You can also condition yourself to add your oral health routine before or after taking a bath. Number 3. Remind yourself of the worst that can happen. When you decide not to brush your teeth before going to bed, try to remind yourself of the worst that could happen. Try to go back to the first 4 minutes of this video to help you get reminded of the worst. You can also try to ask someone to help you with reminders. Patients have shared that having someone to help you get reminded helped them succeed in sticking to their oral health routine. Number 4. Start quitting your vices. Smoking and alcohol can affect not only your overall health, but also your oral health. According to U.S. Centers for Disease Control, smokers are 2 times more susceptible to severe gum diseases compared to non-smokers. The more and the longer a person smokes, the greater the risks. Cigarette smoking and excessive alcohol intake have also been linked to certain oral cancers. Around 31% of oral cancer is caused by excessive alcohol consumption. The survival rate of people with oral cancer is only at 50%. If you plan on improving your overall health, start with controlling these habits. Number 5. Consult your dentist for regular checkups. Some patients would only see a dentist when they feel discomfort or pain. It may already be too late if the decay or gum disease becomes too serious. Even the celebrities we've interviewed have all agreed that preventive care is better than end up paying so much for the cure. And even if you have the money for it, won't it be nice to get to use your own set of teeth than prosthetics? If you are noticing early signs of tooth or gum disease, book an appointment with your dentist immediately. If you don't have any kind of discomfort or pain or early signs of gum disease, start making a habit of seeing your dentist at least every 3 months to prevent any problems from starting. I hope you were able to pick a thing or two from this video. If you like this video, don't forget to hit the like button and hit on the subscribe button to watch more of these videos.